Pain is assessed subjectively primarily, where the patient talks about their pain to the healthcare provider. The problem is that how pain is discussed in different regions of the world, a lot of it has to do with what access do they have to pain. Also, what access to pain medications, for example, or treatments for pain they have, and that can differ from country to country. Also, different healthcare utilization practices are different from one continent or country to another. So, for example, some patients, like in the U.S., if they're in pain, a lot of times they'll complain to us they're in pain after they use stronger pain meds in the United States. Whereas in a place like Ghana, for example, or Nigeria, they might come to the clinic sooner because they may not have access to stronger pain meds, for example. So there's probably more visits potentially to the clinic for pain management in, say, Ghana versus the United States. Also, how far they live from a place that can actually see them for their condition. So in rural areas, for example, in the United States as well, but mostly in Sub-Saharan Africa, they may have to travel for more than an hour or two to actually find a location to manage their pain. So in places like in low middle income countries, they may have to go to a traditional medicine center, for example, like traditional medicine, and get traditional medicine because that might be closer to them and have more access, and it actually might be cheaper than a conventional medicine. So, and then the third point is the number of healthcare providers. You may not have sickle cell trained or a healthcare provider who's familiar with sickle cell disease in different regions around the world because there's not enough healthcare providers in the workforce in different countries. So there's a lot of implications in terms of when patients say they're in pain, it depends on what resources they have to manage their pain. Do they have access to a clinic or a hospital to treat their pain? And then are there healthcare providers that can address it? And also, last thing is finance. A lot of the families in low middle income countries may not have the resources to also pay for pain medications. And even in parts of developed countries in Europe and also the United States, there are also populations that also fit that, where they don't have the resources to pay for it. Well, first of all, having access to a clinic that is knowledgeable about sickle cell disease and has some experience in treating patients with sickle cell disease. So first of all, having a clinic, or identifying patients earlier, like by newborn screening, so that the patient can be educated on sickle cell disease. They can identify what a painful crisis or event is. So number one is it's just patient education. So identifying the patients and educating the patients earlier. Two, giving patients the resources that's available in their region, so that if they go into pain crisis, they can have their own kind of individualized pain plan that is appropriate for them in their region. So I think education is very important, establishing education and for the patient and the family in terms of how to manage pain. Obviously, having access to more disease-modifying therapies is another way. Hydroxyurea is the most well-known of these. Increasing access to hydroxyurea is a game changer in many of our low middle income countries. And what that does, that cuts down on the number of painful episodes, for example, that a lot of our sickle cell patients suffer from. And that's been already shown in Nigeria and also in Congo, for example, that hydroxyurea can make a significant difference in low middle income countries, therefore decreasing the pain burden in that population, obviously. And then the other is having more options, including clinical trials in sub-Saharan Africa and in lower resource countries, so that some of these resources can be, some of these clinical trials can be available to patients in low middle income countries, so getting them involved for that. And I think just also at the policy level, just including the local governments and community-based organizations locally around the world to really advocate, especially in low middle income countries, for the government to pay for some of the services and the medications that sickle cell disease patients will need all their life.